Welcome to the Encore Effect, the podcast where music takes center stage in life's second act. Brought to you by Encore Creativity, America's largest choral organization for adults 55 and older. This inspiring series celebrates the transformative power of music, community, and creativity in the later years of life. Each episode will share moving personal stories from Encore singers across the country and dive into fascinating conversations with experts in neuroscience, gerontology, and the arts. Discover how choral singing is boosting brain health, improving well-being, and lighting up the lives of thousands of older adults nationwide. From retirees finding their voice for the first time, to the science behind why doctors are prescribing music for the mind, the Encore Effect proves that creativity is endless. Join us and let the music move you.
Welcome back, friends, and we're so glad that you've joined us for another episode of the Encore Effect. This is a podcast that helps us talk to all the amazing people who make Encore and our mission happen week in and week out, whether it's partners or funders or those that are helping in research, singers, conductors, coordinators. There are thousands of people who make up the Encore family, and week after week, we get to talk to some of those people. So thanks for joining in. Today, I'm very excited about this conversation as we talk to Dr. Sandra Quinn. Dr. Sandra Quinn is a distinguished scholar whose mixed methods research has transformed understanding of vaccine acceptance, health communication, and racial disparities in public health outcomes. During her 13 years at UMD School of Public Health, she served as professor, senior associate director of the Maryland Center for Health Equity, chair of the Department of Family Science, and associate dean for public health initiatives and associate dean for academic affairs. From 2000 to 2010, she was the professor in the Department of Behavioral and Community Health Sciences and associate dean for student affairs and education at the Graduate School of Public Health, University of Pittsburgh. Dr. Quinn's research team raised well over $12 million in funding and published 129 articles in high-impact journals. She's been the PI on CDC, NIH, FDA, and foundation grants focused on trust, vaccine acceptance, vaccine disparities, and communication during routine and emergency situations, and engagement of racial ethnic minorities in research. She led the establishment of the university's first Pandemic Preparedness Institute. As a recognized national leader, she chaired a National Academies of Sciences workshop on building trust in public health emergency response and served as a member of the National Academy's Committee on Evidence-Based Practice for Public Health Emergency Preparedness and Response. In the MCHE, she led such grants as Building Trust Between Minorities and Researchers, to develop educational curriculum for researchers working with minority communities, and a resource on participation in research for communities. She was PI on an NIH grant supplementing survey-based analysis of group vaccination narratives and behaviors using social media, one of the first NIH grants to examine the impact of social media on vaccine attitudes and behavior. The Dr. Sandra C. Quinn Graduate Student Support Fund was established in her honor upon her retirement in 2023. Dr. Quinn has been singing with Encore since September of 2014. She co-chairs the Arts and Health Research Committee and chaired the Encore COVID Task Force. She currently sings in Annapolis Rocks and Broadway in DC. Hello, Sandra. It's so wonderful to have you on the podcast.
Thank you, Joshua. I'm excited to be with you.
You have this absolutely incredible resume, and we were just talking about before just the pride of all the amazing work that you've done. But I'm just going to start with the last sentence of your bio, that you currently sing in Annapolis Rocks and Broadway in DC because you have a concert tonight, and I know you're excited.
You know, when it comes to concert day, concert night, it is, weeks out, we're going, oh, we're going to make it. Are we going to make it? Is it all going to come together? And it does. The hard work of our conductor, in this case, Catherine Harsha, the 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 time we spend as a group working together meticulously. And so when it comes together and we are up on that stage performing, there are multiple times during that period of time where I get teary-eyed because it's really a sense of profound joy, profound joy.
I love that. Profound joy. So let's back up to when I first got to meet you, Sandra. When I came to Encore in October of 2021, we were just coming out of COVID. It was our first semester back of in-person singing, and it was a really scary time. For everyone, but when we talk about a nonprofit arts organization serving older adults singing during a respiratory pandemic, I don't know that we could have had a bigger recipe for for a challenge.
Good.
And when I came, I thought, how in the world are we going to navigate this safely? And how are we going to bring Encore back to its beautiful state pre-pandemic? And I got to meet you, and you agreed to chair a task force of professionals from all over the country to help Encore specifically live out its mission and its programming. You're truly an Encore hero. But take us back to that time. How did you help Encore, Dr. Quinn, navigate COVID and bringing it back to survival?
It was a scary time, and it's scary in multiple ways, both for our health and our well-being as, individuals, communities, but it was also a scary time because as somebody who had been singing with Encore since 2014, I knew its value in my life. And I also had read that first article that said that it was a choir in Washington State that had, I think, 30 cases of COVID within that choir. So we're a high-risk group because we're older adults, some with chronic diseases, and we're doing a high-risk activity. So, and we love Encore, and we're fearful that it might not survive this. So what was really important to me, Gene Kelly did, a couple of times she reached out to me, or David Simmons, who was working closely with Gene. And, we talked through issues like, would it be okay to open and do Chautauqua in late summer 2021 with the caveat that people were vaccinated? So we discussed that. And when you came on board, the key to me, Josh, was you were willing to listen and you were willing to engage with a group of people who had, experience and knowledge that was different from yours. And that made a huge difference. So it was always weighing that the dilemma, we wanted to feel like things were normal again. We wanted to sing together again, but we really needed to protect ourselves and our loved ones, not just those of us in the room, but those of us we came in contact with. So what was amazing to me was when we made decisions to require vaccines, to require using N95 masks. I know you took some heat from that. There were people who did not like that and said, well, I'll come back when that's gone. But it was the right decision. And by and large, all of our singers, the vast majority believed that it was the right decision. So that to me was also a point when I said that, if we do this correctly and continue to do what Encore does well, then Encore will survive and we will remain as healthy as possible throughout.
And your leadership was really what helped us do that. And it created a culture of trust, and it created a culture of transparency. It created a culture of open communication, every step of the way, whether it was audience distancing or staying 6 feet apart or this first booster or the second booster, like, can we travel? It was just this journey that you helped us navigate, and when we think about all of those steps that we took to keep us singing, I don't think Sandra will ever take singing for granted again, right? Like, it was this moment that made us realize, like, hey, this is something that's so special in our lives, and it was taken from us for a little bit, right? The choral singing aspect, and we'll never take it for granted again.
Well, and I think that's exactly right, Joshua. And that it's the singing and it was the being together. And what was really clear, I mean, I remember distinctly because I've been following all this since early January of 2020 in some of the news sources I follow on infectious diseases. So I already on campus had my department meeting and what I called all hands on deck meetings so that we could plan ahead. And so I remember distinctly we rehearsed in DC. David was our new conductor, and it was a Thursday night. And the next day, the university announced it was shutting down, effective that Friday. So here we are singing on Thursday night. The university goes all online literally the very next day. And we were in a whole new game. And Encore, Gene and staff and the conductors worked really hard to keep this organization alive, knowing how much it meant, particularly to people who lived alone and were isolated and lonely. You know, being able to rehearse wasn't perfect. Did we love it? No, not necessarily, but we loved being together, and Encore University was a stroke of genius.
Yeah, and that's where Encore University was born. And now, still almost 5 years later, it's such a great mechanism for us to create lifelong learning opportunities for people all over the world, really. And I can't tell you, and I'm sure you've heard this too, how many times people have said that what happened during COVID with Encore University and the online rehearsals and how Gene and the leadership pivoted, it really kept people connected. It kept them from feeling isolated. It brought joy to their lives during that time, and a testimony to Encore even during that time. So you said part of the reason you helped was because you wanted to help Encore, but also because you knew the value that it brought to your own life. Talk to us about that value. What is it? What does Encore mean to the illustrious Dr. Quinn?
So it's interesting, Joshua. If we were on screen, I would hold up a 33 and a third, what is it, 33 and a third record from Andover High School senior chorus, 1965. And on that record, we sing Climb Every Mountain, Moon River, Make Someone Happy, What Kind of Fool Am I? Give Me You're Tired, You're Poor by Irving Berlin, You're Never Walk Alone, and of course, the alma mater. Well, that was my last sort of formal singing experience. So imagine years, I always wanted to be able to sing. And I was an assistant professor with a son in middle school and working, a lot. And I heard this NPR story about a group that didn't require auditions and anyone could sing. And I thought, I'm going to find a group like that one day. Well, that was in the late 90s. And in 2013, I think it was, or early 2014, I saw Encore in the Smithsonian Associates, but it was during the day. And I said, wait a minute, if it's for people 55, they're working during the day. So I called up the Smithsonian and said, you're missing a whole group of people here. September 2014, I started in chorale with Jeff Dockin at the Smithsonian. And it was a really difficult time at work. I was leading our School of Public Health through what is a very rigorous and long reaccreditation process, made more complicated by some political things.
Mm,
And I would get on the subway, I'd get downtown, and I say, well, even before that, I say, I'm just too tired to go. I'm just too tired to go.
mm,
And from right away, despite my anxiety about singing, I knew that if I could only do two things in that time period. I could watch Jeff and listen to Jeff, and I could look at my music.
mm,
And it forced me to let go of this, the things I was obsessing about for work and be in the moment. And when I walked out, I felt like I was just energized.
mm.
I was scared. I hadn't sung. I don't know if I can sing. And for a long time, I thought, one day Jeff's going to say to me, don't come back. But that's not the way Encore works, right?
Right. So you are a researcher, right? So that you think of the world probably a lot, in quantitative or qualitative measurements, but like what were you experiencing? You said you couldn't think of anything else. It was a stressful time at work, and so it was time with Jeff building community and listenings, but what were you experiencing physically, mentally in those rehearsal spaces that gave you like this boost of joy that you needed?
That's a good question. So I think one was the challenge of what I was doing. So, I had a rudimentary ability to read music. Um, I had not sung in a choir since high school. So the challenge of paying attention to it's intellectual, but it's also physical. So it's trying to read the music, learn the notation, but it's physical. How do I breathe? So that I can sustain a note on the top of the note, as Catherine says, not going flat. Um, so, but when I tell you, it was like I had been given a shot of adrenaline when I left that concert. And the sense of just getting there, getting to know others and knowing that some of us were sort of struggling together, not knowing, can we do this? I'm not sure I can do this. Um, it was, let's just say, I never ever said, oh, I'm going to quit. I said, if I come back every week, I'm going to learn. I do remember as we got toward the end of that term and concert was coming up, I started to go, oh my God, we're going to sing in front of people? And even I, as nervous as I was, realized that we had made such progress as a collective, all of the singers with Jeff. We had come a long way. So I was elated when we did that concert. I was relieved also.
Yeah, there is a good balance of like excitement and a sigh of relief that you also accomplished it. And 12 years later, you're still singing, still going strong. And you as a singer, as you shared, know the value of what encore and choral singing and our mission bring to your life. But as the co-chair and really the founder of our research committee, you also know that this organization is wellness focused and research based. And I'd love for you to just talk a little bit about why Encore values research. We were founded in it in 2001. The NIH and the AARP and NEA came together and commissioned a study, and Dr. Gene Cohen and Gene Kelly began that partnership. But fast forward now 25 years later, and you're kind of spearheading our research conversations. Why does that really matter?
I'm going to first go back for a moment to COVID, Joshua, because It was COVID and coming out of COVID and the conversations of the task force and with you that really, I think, solidified that health is clearly and well-being is clearly part of our mission. And so I link those two things together in many ways. Encore's unique. I mean, in the last several years since we started talking about research and reviving research as a valuable contribution for Encore to be making, um, you know, there's a lot of interest in singing, some with older adults, with other groups, people with some sort of serious chronic disease, and its impact on health. There's a lot of questions about what are the mechanisms by which that happens? How might, and let's say, active engagement like we do, singing, differ from passive, like sitting and listening to music? We have the unique opportunity, I think, in a couple of ways to make contributions. Number one is we have a faithful group of singers, ever growing. And so, as we work on research with Encore participants over time, I think we will be able to tell stories from the data about how people change. They may come in at 55 or 65, but they may be with us well into their 80s or 90s. What is that? What is their health like? What is their mental health like? And what is the impact of singing with Encore on them over that period of time? And we're hoping that, in a next study, we can do some of that tracking over time. But I think the other thing from reading the literature is, and from, both Brian, Catherine, Marianne's experience, is a lot of conductors are never really trained to work with older adults. They're trained to work in schools. They often, as we know from our own conductors, also do church choirs and other things. They have a variety of groups they work with, but nobody explicitly prepares them to work with older adults. And we believe we have a contribution to make, not only to how do you maintain and promote the health and well-being of singers, but how do conductors and music educators, and I would say even music therapists, what can they learn from the best practices that our conductors have developed over time? Because there's really very little in the literature to guide them on working with people. I'm 74, but we have a singer who may be 92 in the same ensemble. Well, we're different. So I think we have the opportunity to be a thought leader, both in the literature, but also in the profession. And quite honestly, I think the other reason why we value this, in addition to contributing to the science, it's also learning what works for our singers. It helps us further sort of interrogate or investigate what works for our singers and keeping them happy singers, keeping them healthy, promoting a sense of community and well-being.
Beautifully said. I can't believe we're already out of time. I don't want to stop. We're just getting started, Sandra. You have to promise me you're going to come back and do a part two and tell us more about the research that we're doing right now at Encore. Can you give me that promise?
I absolutely will give you that.
Okay, before we go though, and all of what you just said is really the precipice of the work that we're doing now as we head into this next chapter of research. But before we go, we always want to give some advice to listeners. If there is someone out there who loves to sing and has not sung in a choir in many years or never sung in a choir and is a little bit hesitant about joining, what advice would you give them?
Well, I think one thing is, that third grade teacher who told you you couldn't sing is a long time ago. And so, if you can talk, you can sing. You could not come into a place that is more supportive and more accepting than an Encore group, where we will help newcomers. We all make mistakes. And our conductors, in fact, often say, make loud, brave mistakes. That's the only way they can work with us to fix them. So, is come for the joy, come for the challenge, come for the community. And I was really afraid for a long time. And I will tell you that in terms of my own well being, this is the best thing I've done for myself in my adult life.
Well, take it from Dr. Quinn. It's the best thing she's done in her adult life. So you have to come and try out Encore, Encore University, or online rehearsal. You can learn all about who we are at encorecreativity.org. And Dr. Quinn, I can't wait to continue the conversation and the work with you that we're doing in research and how we know that choral singing and the collective, beautiful harmony of voices together makes our lives better. Thank you for joining me, Sandra.
Thank you, Joshua. My pleasure.
And join us next time on the Encore Effect. We'll see you then.